Have you ever thought of a chat GPT of your brain or a digital twin of your brain? That's an idea that's now becoming reality. As India hosts the 5-day AI Impact Summit in New Delhi, there is also focus on AI-enabled health solutions. To talk about that, we are being joined by Dr. Puneet Agarwal. He is Vice Chairman of Neurology in Max Saket in New Delhi and also founder and chairman of Intellihealth or NEURODx. Such a pleasure, Dr. Agarwal, to
Thank
welcome
you.
you on DD India.
Thank you.
Let's begin with your product, your company. Tell us about what NeuroDx is, what it is doing, at what stage of development is your product. If you could tell us about the journey as a whole.
Yeah. So we are a deep tech company, basically making a foundation model, which is hopefully one of the largest model in the world, which is EEG based model, and we also taking the clinical context, clinical symptoms of the patient also, and on the ground of these clinical context and the EEG brain waves input, we are making a multi-modality based AI model, and which will basically, as you have told, it will act as a chat GPT of the brain. So it is a digital brain which we are trying to make, and later on this base model of foundation model, the other people can also make, and we can also make the specialized model, like in terms of solving the different brain disorders, diagnosing these brain disorders like epilepsy, dementia, Parkinson, depression, anxiety, ADHD. So different type of brain disorders can be diagnosed more accurately, as well as they are can be diagnosed even by the MBBS doctor. The neurologist or specialist may not be required. So the beauty of this model will be that this can be employed across the health spectrum, even in the village level. It can provide accuracy in diagnosing this disorder in a very easy way, and even at the multi-specialty or corporate hospital or quaternary hospitals, like any top hospital in India or across all over world, even in the US also, it will provide the same accuracy, and even it will be helpful for neurologists at that center also. So it can provide these kind of diagnosis in a very easy way. So the advantage of this model will be that if you see that especially in the country like in India or similar to the similar countries, in the village, at the village level nowadays, or tier 3 cities, tier 2 cities, neurologists are lacking. So these disorders or psychiatrists are lacking. So these disorders are not diagnosed properly. So with our model, these diseases can be diagnosed very accurately even by the MBBS doctor. So it can be very well linked to our Ayushman, Arogya Mandir, or which were previously called primary health centers. It can be very easily linked to the Sanjeevani or other health portals of Government of India, so that these patients who are not able to come to the specialist center, they can be diagnosed and the treatment can be given by MBBS doctor at the primary level, and then later on these patients can be shifted to the district hospitals for the neurologist for the treatment. But at least treatment can be started. So that's the biggest advantage, and it is a cheaper model. EEG is a very much portable machine, which just like a ECG machine can be carried out anywhere across the world, and you just require asking a symptoms of the patient and do the EEG and just load it. You will get the answer within few seconds. So it is scalable at any level. It is very cheap, affordable model, and it is also fulfilling the dreams of our honorable PM that health can be provided even at the peripheral level where it is not accessible nowadays. So that is our motive of creating this company and doing the things.
So was your product selected under the India AI mission?
Yeah. So our dreams have come true. So we have been selected in the Indian AI mission by the MeitY government, as well as Honorable Prime Minister Modi ji also has discussed our model, and they have appreciated a lot this model.
Okay. Can you also give us an idea of the stage where neurodiagnostics is in India? At what stage is India currently compared to the world, how we are doing, and also the kind of disruption that a device like this that you are coming up with can really have. You told us that there are hardly neurologists, especially in rural areas or semi-urban areas. So, what is the kind of transformation in the landscape that we are looking at if your device is scaled up?
So our company basically is a new company. It's a startup company launched more than 2 years back only. But we are doing research on the brainwaves or EEG analysis for last more than 10 years with IIT Delhi. And we have published our papers in top-rated journal like Nature, IEEE journal already on the this AI models, how to do that in the past. And then now we have formed the company, and we have I have founder with Siddharth also, who is founder with us, Sandeep, Rajesh, and Kailash. So we have a very good team here, who are very competent team who can make these models. So the EG Foundation model, we already started the process. We are in the process of making it. We have to make it in 18 months, which is a time given to us by the meaty government, Ashwini Vaishnav ji and Honorable Prime Minister Modi ji. And besides that, we are already making the specialized model, like epilepsy model is on the verge of completing. We already for diagnosing the epilepsy disorders. Dementia is also in the pipeline. So we are also making a new kind of testing known as brain scan. So that is very important, which is not done anywhere in the world. So it is just like a yearly checkup. Just everybody is doing for the health checkup. We can do this yearly checkup, which is hardly 20 minutes job. With the headband, you can apply over the head, and the EEG will be recorded, and will tell our model will tell the brain health of that person, that where that person is right now standing in comparison to the normalcy, or it is going towards a abnormalcy, like his cognition, IQ level, memory status is going down or not, or any other thing is happening in his brain or not. So that's a kind of brain scan. It is a risk profiling of the brain as well as the health history of the brain that model will tell, and anybody can do yearly later on in any center in India. So which is a new diagnostic test we are proposing, and then which can be done very easily in all across India.
So, will it have preventive usage and also curative usage?
Yeah. So our model is basically having preventive use, just like an executive health checkup. It will tell you preventively that whether this person is having is his cognition is going down, or his mental health is going down. So then patient can consult a respective neurologist or psychiatrist, and in an early stage, very early stage, which is not normally diagnosed by a normal neurologist also. So we can diagnose with this brain scan even before with the subtle symptoms, which normally difficult to diagnose these conditions, like even before the pre-dementia state we can diagnose. And there are a lot of medicines have come, like for example for the dementia nowadays, which are very effective medication, which was not there earlier. So if we can diagnose this condition even in the pre-dementia state, then patient can get those medication and you can prevent the further progression.
Right. Prime Minister Narendra Modi always stresses on responsible AI and India-specific AI development. While this is very much an India-specific AI development to begin with, do you plan to make in India for the world as well? But tell us about how your product is in tune with responsible AI particularly, and data privacy.
Yeah. So when we are talking to our Honorable Prime Minister Modi ji, he was very clear that we have to make a model, and which is a very intelligent way of thinking also, is not only making a toy, just like people are doing chat GPT using, which is, so he's saying that we should make a model, AI model should be used, which is according to the need of that society. It's not only for playing purpose. So that is very clear according to him, and that's what we are doing it. So Indian need is for especially these models can be used in the health sector, which is a great requirement in India, or in the education sector, or in the industry area, which can be used right now, and which is according to the Indian need also. Second is that these all models should be ethically made, and that's why they're saying this is a responsible AI model, that because they are made for some purpose to solve the problems of the society. And secondly, the data should be collected ethically in those models, so that it should be ethical and the responsible AI model. That's what we are making, and so we are collecting the data. We already have a lot of data, and we are collecting further data ethically, as well as we are making the model which is useful for our society in diagnosing different disorders.
You also plan to position India as a leader in neuro AI against big players like OpenAI. So, what is your vision and plan of action going forward?
So if we see India, although we see at current position, India is definitely lagging behind US and China in terms of AI. But with that, I think it's a great initiative taken by our Honorable Prime Minister Modi ji as well as the MIT government. Now this Indian AI mission, they are providing a lot of facility to startups who are committed to make these kind of models which are required for the Indian society, and they are giving the high computing, heavy computing which is required for these models like GPUs. They are providing the financials also to start these models, as well as the other support system they are providing very nicely and in a very expedited manner. So there is no lag behind in this. So everything is done very fastly. So we are very much hopeful that the these start, because there is no dearth of talent in India. So with this pool of the AI engineers and the doctors, we can make the successful AI environment in India, we can make the different types of AI models which are useful for the Indian society, as well as we can serve these models. These models can serve as an example for the world also. So these models, as Modi ji is saying to us also, that it should be made by India and for the world. So these all models, like our model, this foundation model is hopefully one of the largest model of the world. So this will serve purpose not for India but also for the other countries across the world, like in US, in Europe. This model should run because this is a very innovative kind of model which we are making.
Right. Tell us about your participation in the India AI Summit and what are the outcomes that you're looking at?
So Indian AI Summit, we have been given a booth there, and we are showing our model there, what we have made till now and what is in the process in the future. We are showing those kind of models, as well as we are coming with all the equipments like EEG machine and all that to show the models, as well as I think a lot of leaders of the world, they are coming in this AI Summit. We have heard according to the news, the NVIDIA, ChatGPT owners, as well as the Google and the Microsoft. So all the high executives of these companies are coming there, and I think we should be having a very interesting discussion with those people, which can be helpful for inter-exchange of thoughts also, as well as funding to these startups who are displaying the models here. So that will give I think good, not only as a resources. So they will also, this financial aid and resources can be strengthened in this AI Summit, and which can be useful for all the startups in making these models in a more speedy manner, as well as making these models according to the world requirement.
Absolutely. There are immense possibilities for your product going forward within India and around the world. Thank you so much, Dr. Agarwal, for speaking to us on DD India.
Thank you.